My name is Sonia Menning, licensed massage therapist. I'm making these videos just to show some of my clients and anyone else who's interested in what I do for self-care. I know that right now is a time where a lot of massage therapist offices are closed, spas are closed, and I know that everybody out there has their aches and pains and sometimes chronic pain. So I wanted to show you some of the self-care techniques that are beneficial for in between your sessions or while you're not able to get a massage. You can definitely do some self-massage, and I just wanted to show you how to do that. So now we're going to start with self-massage for our head. This is something that's going to be very beneficial for you if you have migraines, if you have tension headaches, if you get sinus headaches or a sinus infection. Some of the sinus techniques I do, because when I do with my clients after they've been laying face down and they come up, they're all stuffed up from laying face down, that pressure. I will help clear out the sinuses so they can breathe a little bit better, and I'll show you how to do that for yourself. So I just want to start with, take your hands and kind of allow some tension in your fingers. And what I want you to do is just slowly grasp onto your scalp. What we're avoiding, we're not going to move the hair around. You're not giving yourself, not like when you're shampooing. What you're doing is you're finding the tissue around your scalp, the skin, and you're just moving the skin. So you shouldn't be hearing your hair rubbing around. It should only be like engaging the skin and moving the skin over the scalp and moving your muscles around your scalp in circular motions. I have my thumbs back here underneath in the suboccipital region, that area that gets very tense. I like to put my thumbs back there and just anchor on like that, pushing up on that area where your head meets your neck, and just slowly going all over your scalp, exploring all these little areas. You'll probably find some that are really tender. You can kind of hang out there for a little bit. Try to make sure that while you're doing this, you really ground yourself, take a nice deep breath, let your shoulders fall back. Don't allow your shoulders to get tense while you're doing this. Just nice and easy scalp massage. Now we have fascia in our body, a connective tissue that's almost like a full body stocking. It goes around our head and throughout our whole body, and it wraps around each organ and it wraps around each muscle, and it's this never-ending tissue. If you look at like when you look at a chicken and you see that white stuff, that's what I'm talking about, the fascia. Now, myofascial release is a massage technique where we slowly stretch and move that fascia and move it around. Sometimes people can get little adhesions in fascia from different trauma and injuries and things like that. So I want to show you just a little bit of a myofascial technique that we're going to be doing with hair pulling. This feels incredible. Most of you who've had headaches, you've already naturally, innately done this to yourself. If it's something you've never had before and you go in for massage on a regular basis, tell your massage therapist that you like hair pulling. Sometimes we're afraid to just go and pull on somebody's hair because we don't know if they'll like it or not, but speak up and let your therapist know if you like it. You can do this in a few different ways, or even have somebody else do it for you, but I'm just gonna kind of spread my fingers out like this, and you want to just grasp onto your hair. You don't want to find little parts of, if you have like one little hair there and you're pulling on it, that's going to hurt. But when you have a lot of hair clumped together, it doesn't hurt. So what we're going to be doing is we're actually stretching out the fascia that covers our whole head and face. So we're going to grasp on and pull up. Move it around. Take your hair into a big ponytail. on it. This one's easier if somebody else pulls on it for you. And it relieves an incredible amount of tension in your scalp. All right, so next we're going to go into some of the sinus areas. If you're getting a migraine, the best time to do this, or a headache, is when you start feeling it coming on. Sometimes you have triggers. So if you start to have those feelings, it's good to take a minute, stop yourself, ground yourself, do some breathing, and then start with doing some facial and head massage. After you've done the hair pulling and the scalp massage on yourself, take these two fingers and go right up here at the top of the bridge of the nose, right where your eyebrows start, and just go upward and inward. Apply some pressure into this area. Sometimes it's a very sensitive area, so just work within your own comfort zone. I like to do circles, press, release, press. About maybe up to 30 seconds to a minute, you can do it in that spot, and then repeat it up to 2 to 4 times. After you do this little area, I want you to find your eyebrows and grasp the eyebrows and grasp the tissues, and I want you to just squeeze. Close your eyes and just squeeze the tissues around your eyebrows. There's actually a muscle around your eye that I'm squeezing right now. It's the orbicularis oculi. It's a circular muscle around your eyes. Grasp onto the ends and squeeze. You can spread your eyebrows out, spread your forehead out. Just make sure you've washed your hands before you're touching your face. Okay, so now what we're going to do is work with the bridge of our nose. Work throughout in here for your sinuses. So you can take your pointy finger or your middle finger, and I find that little indentation along the bridge of your nose. And I want you to start where first we started up here. Start where you find that first indentation. So if you move your fingers out, right about in here, you'll find this indentation. And I want you to, I'm going to use these. I want you to slowly do the circles, press in, release, press in, and move your way all the way down to the side of your nose. And then you can take your fingers and just drag all the way down. You'll notice you can actually breathe in a little bit better when you clear out your sinuses that way. Then what you can do is take about 4 fingers. I like to use my ring fingers to hook underneath my cheekbones, right in here. And then the upper fingers right here. And I want you to we're going to be doing circles all the way up. Right along the cheekbones. You'll start to get into your jaw muscles that you didn't know were hurting. We clench our jaws a lot when we're stressed. And then you can just spread. And I kind of like to come through here, just spread, spread, spread underneath. All right. Okay. So now we're going to go into the jaw a little bit. Many of us suffer with TMJD. TMJ is the joint in your jaw that allows you to open your mouth and close your mouth. so many people suffer with TMJ dysfunction. And if you're one of them, if you feel your jaw clicking, if you tend to clench your teeth a lot, sometimes people do that at night when they're sleeping, they clench their teeth. It's called bruxism. And you can tend to get very painful. Sometimes your TMJ, this little band of connective tissue will actually slip out of place where it's supposed to be, and that can take a few weeks to recover from. But if you're just an average person with some jaw pain, I'll do some basic techniques. With some of my clients that suffer, I do gloved work, and I'll actually go inside the mouth and really work on some of these specific small little muscles. They're called the pterygoid muscles in there, and really try to release those muscles. But just for the sake of relaxing your jaw, first just be aware when you're especially when you're angry or you're tense, ask yourself, oh gosh, what is my jaw doing right now? And you'll notice that, oh, I'm clenching my teeth. So stop doing that. So try to be self-aware of that. People do all kinds of things when we're operating in stress mode. We clench our jaws, we wear our shoulders like our earrings, we tense our butt muscles, our glutes, we do that a lot with. So just check in with your body and see where you're carrying that tension when you're frustrated. So with the jaw work, if you open your mouth, you can feel there's a little triangle right in here. There's a little triangle right in here where that joint is. It's right where you can kind of feel your cheekbone above your finger and your jaw below your finger. This is where the joint is. So it's a pretty sensitive area for most people, especially if you're a clencher. So just find some of that tissue in there, some of those muscles, and I want you to just hold some nice pressure on those areas. Not too much, within your comfort range. Just hold those areas for a little bit. Breathe. As you feel the tissue relax, it kind of melts like butter, then you can apply a little bit deeper pressure. Then you can move along, move up. We're all in this line here underneath your cheekbones. Do the same thing. You can go in circles if you want, press, but I like to kind of just hold the area, hold that muscle and relax my jaw. When you start to feel the pain go away and you feel those muscles relax, you can go in a little bit deeper. Sometimes it'll refer pain from here all the way up to your temple area. We're really working on the top part of your masseter muscle, a strong muscle that you use when you chew your food. And you can come down along this side. Now, if you have major dental problems, some of the pain will that you feel in your jaw might be from dental problems. Sometimes with TMJ, you also have a lot of ear pain or weird like sensations of like wind blowing in your ear and things. Other things that can cause that too. But you should really seek a specialist if you're trying to figure out where that pain is coming from. If it's coming from a dental issue, if it's coming from an inner ear infection or something wrong with your eardrum. There's a lot of different symptoms that can overlap. So I just advise you, if self-massage techniques don't work, don't be afraid to go see your specialist and find out if there's something underlying going on. That's the case with anything, any kind of pain in your body. There might be something, it might be an organ if your back hurts. So there might be a lot of different things that could be causing it. So just make sure that if it's something chronic and doesn't go away, that you speak with your doctor about it. So we're just going to continue doing circles and holding areas along our masseter muscles. When you find those tight spots that are really particularly sore, kind of just you gotta be so patient and just be in the moment with it and hold it and feel it release. Sometimes you'll get little twitches, little muscle spasms. Those are actually good. They're called a local twitch response. Our brain is sending signals out to get those muscles to contract and release so that it can let go of that tension. It gets blood flow into those areas. The way that massage works, really honestly, is when we apply pressure to a muscle and we let go, blood rushes into the area, and blood carries all the nutrients, the calcium and everything that we need for those, and the oxygen for those little fibers to let go of their contraction. So press and release. You can pinch along your jaw. Up to that ear, part of your ear, and come back down into that joint itself and press. If you're not sure where to find that joint, come under here and then open your mouth. It'll pop out. If you have TMJ, it'll click. Okay. Lift that up. I like to kind of just start to, with an open hand, get some of my front neck muscles.